Okay.
All right. Good.
All
Yes.
right.
So what question did you have about your, I'm just
Um,
going to feel your hand while we talk.
okay.
Yes.
Well, a few things. I do know that it is going to be cutting into my artery and my vein
Uh-huh.
in there. So the biggest questions that me and my mom have are what precautions after the graft is finished that we might have to worry about,
Uh-huh.
and any care for the fistula itself.
So there wouldn't be any precautions as such. The most important thing would be, number one, no heavy lifting. So you don't want to lift anything more than 10 pounds with that hand for the next 4 weeks after surgery. Number two, obviously, you got to make sure it doesn't get dirty. Usual wound care instructions. So you want to make sure the incision doesn't get dirty, is not exposed to anything infectious, and you want to keep the area, a good way to put it is you want to keep the area clean and dry.
Okay, so now when it comes to that, is that going to be affecting my ability to, like, say, swim or shower or anything like that? Because I know I can't shower with the catheter.
You cannot swim.
Okay,
Correct.
no swimming at all.
For the first, till it's healed up.
Okay,
For the
so
first 4 weeks.
okay, so
Yes.
that's only temporary.
So
All
till
right.
till it heals up, you cannot swim, you cannot submerge it underwater for long periods of time. Obviously, like you said, from my perspective, you can shower, but with the catheter, you can't shower, right?
Right. So I
But
might
from
just
the
wanna,
incision
like,
itself, you
cover
can
it.
shower.
Okay, all right. And then, like, after the 4 weeks, if I swim in, like, say, lake water or something, just like normal wound care to clean off the area.
Yeah, we'll have
afterwards?
to check before, depending on how well it is healed up. Everyone heals differently. Some people I'll see in 4 weeks it'll be completely healed up. Some people in 4 weeks it's still not healed up. So it'll all depend on how well it is healed up after.
Okay. Well, luckily I won't have to worry about any swimming until like next spring.
Correct.
Now, future limitations after the 4 week healing period. Is there anything I need to worry about there, like any weight limitations or mobility issues?
No, if it's healed up well, then no. But the few things that you would need to keep a watch on is, number one, you can't sleep on that arm, so you can't press on it. If
Okay.
there's any compression on the fistula will close. Number two, you want to make sure your blood pressure doesn't drop too much. The top number on your blood pressure, we recommend shouldn't go below 100,
Okay.
or else the fistula can close. And then number three, we tell this to all the patients. So, like I told you, we're going to take the blood flow from the artery and put it in the vein. So it is not uncommon for patients to have a little tingling, numbness, discomfort in the arm or in the hand.
Okay.
So when you use it, you'll realize that this is not as strong as this hand.
Okay.
Your left hand is not going to be as strong as your right hand.
All right.
That's kind of unfortunately expected course. Some people get really lucky and they have no symptoms at all, but most patients will have some form of maybe a little tingling, maybe a little weakness, all those kinds of things in the hand.
Okay. Now, on the blood pressure issue that you mentioned, I have been. If you want to take that first, that's okay.
Give me 1 second.
Not a problem.
Yeah.
So with the blood pressure issues, I have been noticing with my dialysis, especially after my last treatment, that it does drop my blood pressure like a relatively decent amount. So am I going to have to go on any medications to make sure my blood pressure stays up to prevent the fistula from closing during the
Your
process?
nephrologist will manage that.
Okay, so I'll have to talk
Correct.
to Miran about that. Okay.
Yes.
All right. Now, the operation process itself, how exactly, like, I didn't really get a chance to do too much research on the AV fistula itself, and it seems that any of the information I look up on Google is overly technical.
Mhm.
So how exactly does this work? What does this involve for me? Like, am I going to get knocked out? Is there going to be like this big box on my arm?
So you are going to get knocked out for it unless if anesthesia thinks that it would be too high risk to do that. Otherwise, we'll put you to sleep all the way.
Okay.
So you won't feel anything during the surgery itself. Right after the surgery, you may have a little bit of pain, for which we give you a prescription with pain medicines.
Okay.
That would be what you would be expecting. Now, there's always expected a little bit of swelling and discomfort after surgery, just like it would be like whenever we cut on you anywhere.
Right.
That would be kind of expected. Most patients don't have a lot of pain after 5 days. Swelling is hit or miss. It could take a few weeks for the swelling to go down. Sometimes it could take months for the swelling to go down.
Okay.
Yeah, sorry, this is just a busy day.
Yeah, understandable. No pressure. Okay, so Yeah, actually, that's really not a lot to worry about. You said it's going to be about a 4-week recovery time before I come in and see if it's grafted in properly?
Yeah, but for it to be ready, it's going to be months. We discussed this in the hospital as well.
Right.
The 4 week is for the incision healing.
Okay.
But for it to be ready to use, it's going to be months, and then usually before we say it's ready to use, we get an ultrasound and look at it and see whether it's ready or not. Sometimes it needs a little help. I will take this opportunity to tell you that about 60 to 70% of fistulas work only. So
Okay.
that means 30 to 40% of fistulas don't work.
Okay.
And then you'll need a fistula at a different place.
Whew, man, let's
Yes,
just
sir.
disable one body part after another, huh?
No, it's not going to really disable it, but yes, that unfortunately, that's the success rate, national guidelines.
Okay. And I guess lastly, like, once the fistula is actually, like, working, and it does work, what are we doing about my new friend here?
So 2 weeks with no problems. Once the fistula is working for 2 weeks with no problems, we take this out in our office.
Okay. Now, is that going to be, like, leaving, like, a big scar on my chest or anything
No,
like that?
it's not only going to leave big scars. It's going to leave this much of a mark.
Oh, okay. So that's really not much of anything then.
Right.
See, I was kind of worried because there's this one person I work with, and he's a dialysis patient, and he's got this like horrendous scar up here from it, and it's like, holy crap, is that what I'm gonna have to deal with? Like, oh no.
Shouldn't be. Again, this is what I can tell you right now on the basis of what I'm seeing there, what I'm seeing there. As things change, the plan changes, but shouldn't be. Usually, it's just where the catheter goes in, just that much of its scar. That's it.
Okay. Well, I guess the last thing is about how long before we think we can get me on the table and start this process.
Probably about 2 to 3 weeks. It's going to be a guess. I put down the information and I give it to Giselle. She's our scheduler. I usually tell my patients if you haven't heard from her in about 3 to 5 days, give her a call.
Okay.
Because she does all the scheduling for all the patients. I'm just going to grab the paperwork while I have you here, okay?
Excellent. Thank you very much, Doctor.
Yeah.
Oh, fumble. Did not mean to drop the camera there. That was Dr. Kahn, my vascular surgeon, and that is the information that we need. All right.